Namaskar, this is Dr. Hema Divakar, the Chairman and CEO of ARTIST. ARTIST expands as Asian Research and Training Institute for Skill Transfer. The Mother's Day event, which happens to be on the 8th of May, this marks a very special milestone for ARTIST because Dr. Harshad Sanghvi, who is from Baltimore, Maryland, Japago, who is the head of the Center of Innovations, who sowed the seeds of what is called a skill transfer a decade ago when he visited the city of Bangalore, and we had an exercise of how the knowledge and the skills are to be transferred for a competency-based training. Well, it has taken a decade to imbibe, absorb, set things into place, set our vision towards establishing the ARTIST Skill Gurukul. So we are very privileged indeed to have the center inaugurated by Dr. Sanghvi. The scientific director of ARTIST, Professor Isaac Menionda, who is from St. George's University Hospital at London, UK, is also here with us on this very special occasion. And he always believes that ideas or innovations, any or many people can throw, but bridging the gap between innovation and implementation to actually get onto the action mode and make the research reach the women at large, which means that innovation to implementation, bridging the gap from the thoughts, ideas to the action, translating evidence and research into reality. That has been his vision, which has also supported many of our ground level initiatives in both rural and urban India to bring new initiatives into the Indian context and to figure out what is practical, what is pragmatic, what works for us, and even bring in some policy changes at the state and central level. So the entire vision of ARTIST Skill Gurukul is to train all the frontline healthcare providers. There are 30,000 specialists in the country, the OBGYNs, who have dedicated their lives to women's healthcare. But, dear friends, the scale of the population, the number of deliveries, and the need for the women's healthcare is way too large in this big country of ours, because there are 30 million deliveries happening every single year, and we need a whole band of people beyond the specialist cadre to deliver healthcare. So the vision for ARTIST Skill Gurukul is to train the specialists in their own capacity on short and smart modules, but also to extend this training to the postgraduates, to the medical officers, to the staff nurses, to the health counselors, to the health educators, and even lay women and various age groups of women, the adolescent, reproductive, and the menopausal women, because knowledge is power, and to raise the demand from the people themselves to empower them to seek the best of the healthcare. So the modules in this are going to vary from simple things like bringing in a lifestyle change, that is advice about the diet and exercise, which is, as of now, so theoretical, and it doesn't seem to be really translating into the lives of women in the country, to the whole range of a variety of things on infertility, contraception, the emergency obstetric care, etc. But essentially, all these modules are going to be short and smart modules at the weekends, so that the target we are hoping to address and train would be available to us more easily. So it's like a user-friendly Gurukul, so that they come in for a short span of 3 hours. It's a low dose and a high intensity training that we hope to impart, and the role plays, the interactive sessions, the time devoted to the question and answers, the skill stations, each one rehearsing and practicing what they actually need to do is what the concept of skill transfer is all about. So as a curtain raiser to the Artist Skill Gurukul, on the 1st and 3rd of May, we've already had 2 batches of the specialists and the staff nurses and health counselors train with us for the lifestyle modification, with the lead expert, Mrs. Kavita Kapoor, training us on the lifestyles, and the master trainers from the Bangalore Medical College for the post-placental IUCD insertion were there to train a bunch of people from 2 leading medical colleges, the assistant professors, the staff nurses, and the postgraduates from these colleges came to the Artist Skill Gurukul to train in the PP IUCD, or the post-placental IUCD training program. So the modules are going to be devised in a short and smart manner, and we have the vision of taking very few people in a batch so that the training is very intense, and we make sure that once the training is imparted at the Artist Skill Gurukul, they can actually go out and implement it in their own practices right from the very next day. So this is the beginning of the initial few steps that the Artist Skill Gurukul has taken. On 6th of May, at the backdrop of the Mother's Day, it is like the mother organization transferring the skills to all the frontline healthcare providers, and we do hope, with the best wishes both from Dr. Sangvi and Professor Maniyonda, this will go a long way in creating a new cadre of quality healthcare delivery to the women in India.